A number of tests are used to diagnose pulmonary hypertension. When a patient comes in with symptoms that suggest this diagnosis, the first and probably most important initial test is a thorough history and a thorough physical examination. If the history and physical suggest that pulmonary hypertension is a very likely diagnosis, the next step I would take would be a chest X-ray and an echocardiogram. There are characteristic chest X-ray findings in pulmonary hypertension that would help support the diagnosis. And the echocardiogram is a very useful, non-invasive form of testing that can tell us a lot about the heart. Not so much about the lungs, but it's the heart that is affected by pulmonary hypertension that the echo will tell us about. This diagnostic work can be done very rapidly. A chest X-ray can be evaluated as soon as it's developed. Where nowadays we don't use film anymore, it comes out right on a computer screen. Echocardiogram, as soon as it's finished, the doctor can look at it and the diagnosis is there. The findings are there. If the echo and the chest X-ray and the examination all point to this diagnosis, the next step would be something called a heart catheterization. And this is the gold standard for making this diagnosis. So after all of the simple, the non-invasive evaluation has been done and we're pretty sure we're dealing with pulmonary hypertension, the next step is, number one, to confirm the diagnosis with certainty, and secondary, to stage the disease. By staging the disease, I mean to determine how severe it is, where in the progression of this disease this particular patient happens to be, because this is how we will formulate treatment. A heart catheterization is a procedure that's done in the hospital in a special laboratory that has pressure monitoring equipment as well as X-ray equipment. A needle is placed in an artery right under the skin after some anesthesia is given, local anesthesia, and a catheter, which is a flexible plastic tube, is advanced up into the heart. The patient can't feel this inside of them. He's wide awake and often watching the procedure. It's very interesting for him to watch. Once the catheter is placed in the pulmonary artery, pressures are made both in the pulmonary artery and in the lung arteries, further into the lung arteries. Pressures are also made in all the right-sided heart chambers. This probably takes about 10 or 15 minutes. And then certain medications are given to the patient to see if the pressure, the high pressure in the artery, responds to these medications, because that's how we'll make our initial assessment of how to start treatment. So if we confirm the diagnosis of pulmonary hypertension by elevated pressure measured, and if we give a drug that lowers that pressure significantly, that tells us that this patient will respond to one or another form of treatment. And that's why this is considered the gold standard of diagnosis.